Hey everybody, Dr. Kaylee here. I am going to be discussing how to know when you are ready to jump, when you are ready to run, when you are ready to get into some of the plyometrics that we have later on in this course. I put this video here because it's really good to go ahead and do it just to kind of see where you are. Take the things that I'm going to go over, use them as kind of part of your strength training to see if we can build some of that stability, some of that strength before we go into that. Now, I want to say first, the very first thing you need to do when you are trying to return to running or jumping is see a pelvic floor physical therapist. We are trained to be able to kind of do measurements. We're going to do a pelvic exam. We're going to be able to help with any symptoms to really help truly get you back to that exercise level that you want to be at. So it's important that you do that, okay? So see a pelvic floor therapist. I will have some links of directories listed below if you're not in the Tampa Bay area so that you can truly find one. The next thing to understand too is signs that you are not ready to return to running or jumping. Any urinary incontinence with that exercise, any fecal incontinence with that exercise, pressure or heaviness in the vulva or the vaginal region, any issues with pain like pubic bone pain, back pain, hip pain, pelvic pain, anything like that. Honestly, any pelvic floor symptom means we're not quite ready yet, and that's okay. I also like to reiterate, it's important to understand that I don't actually like to clear anyone until minimum 3 months postpartum to be able to run specifically. We get you into jumping a little bit sometimes before, depending on your prior level of activity, but that's a good guideline. Is between 3 and 6 months is a good kind of mindset to say, that's maybe when I can start to return to that. So some of the things that we're going to do first to do this, I'm going to take you through my protocol that I do in the clinic. And again, remember, you need to see a pelvic floor therapist to make sure you're doing them properly. I'm going to do my best to show you form. But the first thing that you want to do is just pelvic floor related. This is something that your pelvic floor therapist would go over with you, is being able to do 10 quick just pelvic floor contractions. So closing up or lifting like an elevator without compensation. That's why it's important to see someone to help you with that. Because if you squeeze and we're squeezing the glutes and the abdomen, we're not actually getting a good pelvic floor contraction only. So we want to make sure that we're doing just a pelvic floor contraction 10 times. Then you're going to do 8 to 12 of those reps with a 6 to 8 second hold to test endurance. Are we able to lift up and hold without losing control? 6 to 8 times. And then we're going to do a 60 seconds. So you're going to hold for 1 minute, but it's going to be a sub-max contraction. What that means is, can we lift up about 50% and hold that for 1 minute? It's not as easy as it looks. A lot of us can't even find our pelvic floor. So that's why, again, it's so helpful and important to see a therapist to make sure that we're getting the right muscles on. The next thing that I'm going to take you through is making sure that you can walk. Just walk. And I mean, like, not a walk where you can't talk or you can't breathe, but we want to have a pretty quick walk where we're doing a 30-minute time frame. So going out for a walk, coming back, do I have symptoms? Did I have leakage? Did I have pain? Did I have pressure? If the answer is yes, we're not quite ready to run yet. If we're super light, like winded, really tired after a walk, we want to stick with walking first, and then we'll start to build our stamina. The second thing is being able to stand on one leg. So 1 foot down, the other leg lifting. Can you do this for 10 seconds without falling over? Can you do it on both sides? I challenge that we should be able to do 15 to 20 seconds. Notice I was talking there, that's why I fell. But being able to challenge your single leg balance and seeing, am I able to hold that without falling? Because running is such a single leg activity, we have to be able to know that the foot hitting the ground is adding stability, and that the force and the pressure going up the kinetic chain into the pelvic floor is not going to cause an issue. The second thing is a single leg squat. So being able to stand on one leg forward, not necessarily a full pistol squat, but do you have stability to go down and come up without falling, and being able to control and manage unbroken 10 times on each leg. Then, can we turn on a stopwatch or a timer? Can we jog in place for 1 minute without having any symptoms? If the answer is no, we're not ready to run or jump. The next one is going to be forward bounds. Can you stop right here? Can we bound forward and then step back? Can we do that 10 times without pressure, heaviness, leakage, issues in the pelvic floor? Can you do 10 single leg running man unbroken without falling and without issue? Bringing the leg here, opposite arm forward, and then we're going into kind of an RDL. Bringing it right back up. Can we do 10 on each side without falling? And then single leg calf raise. I'm picky about all of these because of form and where we feel it. Single leg calf raise. Can we do 10 to 20? I challenge 20. But are you able to do them with feeling it only in the calf? Do you feel it in the hip? Do you feel it anywhere else? Are we able to turn on the calf? Single leg glute bridge. Also being able to do 20 of these unbroken without losing it, with feeling the right muscles, not falling over, being able to feel the glutes and the hamstring. And the other one on the floor being side lying hip abduction. Can you feel when you lift your leg up? Do you feel the back of your glute or your buttock region when you lift it up? Or are you compensating? Are you feeling other things? And then the last one that I'd like you to try is single leg sit to stand with a chair. So you're going to take 1 foot forward, 1 foot back. You're going to sit, and I don't have great control with my single leg sit to stand, probably why I have symptoms with running. So it's important to go through those. And again, a lot of the evidence shows 10 to 15 reps. I always challenge push for 20. Once you can hit 20, no symptoms, no issue, probably a good time to start running and jumping. This is not like end all be all. Let's say you can do 75% of them and just a few of them you struggle with. That doesn't mean that we're not going to run, we're not going to jump. All that means is that we're going to try to work our way to that so you can build strength, build stamina, build endurance to get to the point of running and jumping. We use these as exercises sometimes. Let's say you can only do 6 of something. Let's work on it. Let's exercise. Let's try to do more. Do it a few times a week. We realistically want to try to strength train 3 times a week to get those muscles nice and strong. So that's kind of a clearance to running. How to know, am I ready to run or jump? Give yourself credit, work through it. Let us know below, send us a message on how you did, and then we'll go from there. There's also a PDF printout of those.